What's up, guys? This is Dr. Kyle from Cape Chiropractic and Acupuncture coming at you with this week's movement tip of the week. This week we're talking about belly breathing or diaphragmatic breathing. Now last week we talked about the dead bug exercise and how that's really good for lumbar stabilization. And one of the prerequisites to doing exercises such as the dead bug and other core stabilizing exercises should be proper breathing. Now, frequently, what we see in our everyday population, or most people, is what we call chest breathers, or people who are unable to breathe or expand through their diaphragm. Now, the diaphragm attaches around the thoracolumbar junction, right in through this region, and actually forms the top of what we sometimes refer to as our canister, or our intrinsic core region. So the diaphragm actually forms the roof of this canister, which creates a cylinder in the lumbar spine to help create that stable core. If this canister, or top of the canister, is not working properly, then it can lead to postural deficits, it can lead to discomfort in the lumbar spine, the sacroiliac joints. It can lead to very, very tight musculature, especially in the back through what we call our erector spinae, and even into our neck, into our what we call our scalenes, or our SCMs, these muscles in our necks. So having proper respiration patterns or respiratory patterns is crucial to, it's a crucial step in initiating proper core stability and postural function. So a few things you can do to check this on yourself. And one of the most simple ways is to lay on your back. So if you lay on your back like so, and take one hand and put it on your chest, the other hand and put it right in your lower rib cage. So one hand on your chest, one hand in your lower rib cage. And just breathe normally and just take a nice big breath in. And you can do it a few times, but most people, what they tend to do is when they inhale all from their chest, so they'll feel this top hand expand a great deal. Now, as you're breathing through your chest, this recruits muscles into your neck, it recruits muscles in your upper, or your mid and lower back to do jobs that they're not supposed to do. So one thing you can do is really focus on trying to expand with your belly through your rib cage and abdomen here without having any motion occur in your chest. It's a lot harder than it sounds, and a lot of people have a lot of difficulty doing this. So it's something to practice. So continue to try and breathe and expand through that belly. There should be a nice expansion all through this region. If this is starting to get a little easier, what you can do is put your hands on your hip bones, take big breaths, and try and direct the air down towards your hip bones. Again, there should be no motion from your chest here. Now, after you've mastered this, as simple as it sounds, then you can progress it into movements such as the dead bug from last week. Again, with minimal chest motion, most of the motion coming from your lumbar or your stomach here. Now, there are very few ways that we are able to access or really change how our nervous system is responding. And being able to take big belly breaths like we were just talking about, or diaphragmatic breathing, is one of the ways to actually reduce what we call our sympathetic nervous system. So beyond just helping with postural function and in activating the proper deep musculature for core stability, belly breathing or diaphragmatic breathing can be very helpful from a muscle relaxation standpoint, and literally can help reduce the amount of muscle tone that we have. And again, also what this does is promote proper patterns and reduce the tension that we're feeling in all of these, what we call our accessory breathing muscles that should not be being recruited during everyday life. Now, I know this may seem really simple, but I really want you guys to try this out, because I feel like many of you will find it more challenging than you are willing to admit. So stay tuned next week and give this one a shot. Thanks, guys.